Hi everyone, today I shall discuss about a very important specimen for the examination, not only for the examination but it is important in the clinical field of life. Now you see, this is a specimen comprising of tongue, larynx and pharynx. Now how will you hold it in anatomical position? You see tongue is protruding forward and you hold the tongue in such a way, that is the offerings when you do some flower offers to the deity. So in this offering position you will hold the tongue and you suspend the tubes, that is the pharynx and the larynx below. So this is the anatomical position of the tongue, larynx, pharynx. Now first I will show you in the tongue. You will see this is the tip of the tongue which is protruded forward and it is lies below the occlusal, behind the occlusal surface of the teeth. Then you will see this is the base of the tongue. Next, this is the lateral border of the tongue. In the lateral border, you will look, there are some impression for the teeth, Next, you will see in the tongue, it is covered by some elevation and depression, and this elevated mass, which is finely hairy like, this is known as the papilla. You will see, if you protrude your tongue, you see in front of the mirror, you could see this is all are filiform papilla. And in the, you will see at the junction of anterior 2/3 and the posterior 1/3 of the tongue, there is a sulcus. This sulcus is known as the sulcus terminalis. In front of the sulcus, you will see that there are some elevated masses and these are the papillae, and this papillae is known as the circumvallate papillae, where the taste buds are situated. You have got the different tastes like sweet, that is felt in front, the sour on the side, and bitter it is behind. So this is known as the vallate papillae or circumvallate papillae, about 10 to 12 in number. So the posterior 1/3 of the tongue, you will see it is very much rough. Why it is rough? Below, because beneath the mucous membrane there are the presence of aggregated masses of tonsillar tissue. So this is known as the lingual tonsil. Why there is the tonsil? Because you see, when the air enters or the food enters in our mouth, what will happen? Most of the bacteria, it goes from the mouth and enters inside, and there is some arrangement by the Almighty that there is a presence of some immunological thing before the entering into the inner side of our body, and this immunological thing, lingual tonsil below, and this is the palatine tonsil or D tonsil, which you will see when we will open the tongue, and everybody in the childhood suffer from the tonsillitis. So this tonsil protect us from the bacteria that goes inside. So this is the first line of defense, and along with the nasopharyngeal tonsil, it forms the Waldeyer ring, a ring like tonsillar tissue. Now if we pull this tongue, then you will see this is known as the epiglottis. This one is the epiglottis. You know, in the previously we know that epiglottis descend down and fall on the larynx. That is not true. Epiglottis remain in the same position and the larynx come up and close the inlet of the larynx. Now this epiglottis, it is made up of elastic cartilage, so that never it becomes turned into a bone. And this fold is known as the glossoepiglottic fold. So this is the median glossoepiglottic fold. And you will see on the either side of the median glossoepiglottic fold, this fold is known as the lateral glossoepiglottic fold. And within this area is known as vallicula. Vallicula means small valley. So this is the vallicula of the tongue. Now you know the anterior 2/3 of the tongue and posterior 1/3 of the tongue, developmentally it is different, and that's why nerve supply is different in the two parts. Anterior 2/3 of the tongue, it is supplied by the lingual nerve, general sensation. General sensation mean touch, temperature, these are the general sensation. And special sensation, that is the taste, that is done by the nerve that is known as the chorda tympani nerve, branch of the facial. And the posterior 1/3 of the tongue, it is developed from the 3rd pharyngeal arch. So here nerve supply is general sense and the special sense by the glossopharyngeal or 9th cranial nerve. So this is the tongue, and you will see here, now I will show you the pharynx. You will see I show you the pharynx in the posterior portion because the anterior portion of the pharynx is open. Now anterior portion, it is open. You see, this is known as the oropharynx. It communicates with the oral cavity. Similarly, if I cut the pharynx, if you will see here actually the laryngopharynx. You will see this is the laryngopharynx, and this is the larynx or our voice box. We speak, we talk to each other, we modulate our voice, we make singing by means of the vocal fold. So if I open the larynx, this is the interior of the larynx. Within the interior of the larynx, you will get two fold. The upper fold is known as the vestibular fold, and lower fold, it is known as the vocal fold. So this fold is responsible for different types of voices, what you are done by the different muscle that control the vocal fold. So you will see here. Now another thing I will show you, that if I close the larynx, then you will see there is a region. This region is known as the inlet of the larynx. From the nose, the air passes through the inlet of the larynx, and it is bounded in front by the epiglottis and on the side by the aryepiglottic fold. And you will see there is transverse arytenoideus here. So this is known as the inlet of the larynx. So when we will taking food, we cannot take respiration. You will see this becomes closed. And when we will respire, we cannot take food. So both are not taken simultaneously. So this is the inlet of the larynx, and by the side of the inlet you will see two depression, and this depression is known as the piriform fossa. In the earlier time, the smuggler, they insert the precious thing here so that nobody can detect, and again take it up. So this is the type of practice they will do. And another thing important clinically, that when there is a fish bone stuck inside your throat, what you will see, the fish bone is located here. So you require some ENT surgeon to remove this fish bone, if it is not done by any Ghoroa method, I think. So household method. So this is known as the piriform fossa. Next I will show you another things. You will see, you can identify here. This is the epiglottis. This is the thyroid cartilage, which one can see in front, particularly in case of male. There is a Adam's apple in front. You will see here In front view, this is the Adam's apple. This is the thyroid cartilage. And in front of the thyroid cartilage, you will see the butterfly like this type of small muscle. This is known as the cricothyroid muscle. And beneath that, you will see there is a gland. You will see this is our thyroid gland, which is very important. If the thyroid gland become less active, it will produces hypothyroid, and that will increases the thickness of the skin. Our cognitive power become diminished. And the skin become rough. So this is about the specimen of tongue, larynx and pharynx. Thank you everyone.